How was your weekend?
It was pretty good. I'm really tired though.
Why?
I was up till like 4 watching movies. It was good.
Last night was a Tuesday.
Hi class.
Hey, how are you all doing today?
I'm doing fine.
Good. Well, today we're going to review a little bit about Florence Nightingale and cleanliness. So I'm going to read a quote. It cannot be necessary to tell a nurse that she should be clean or that she should keep her patient clean, seeing that the greater part of nursing consists in preserving cleanliness. So that's what we will be focusing on today. I'm going to read some more quotes. Every nurse ought to be careful to wash her hands very frequently during the day. If her face too, so much the better. So we can see that hand hygiene was important even back then. And our motto for the day, as put by Florence, was one word as to cleanliness, merely as cleanliness. So, what Florence changed, she realized that patients need well-ventilated rooms, calm, clean spaces. They need to be washed with hot, soapy water, and that you need to perform lots of hand hygiene. So what can we take away from this and use today? Well, today we use lots of gloves. Every time your gloves are soiled or you've dealt with a patient, you need to change your gloves, soak them away. Perform hand hygiene, gel in, gel out. Don't recap sharps, ever. No, that is bad. Now, some more professional type things, you shouldn't wear artificial nails because bacteria can get trapped underneath them. You shouldn't chew gum, and you should limit the amount of jewelry on your body because that can also carry contaminants. So here's a little pop quiz. See if you guys are paying attention. What war was Florence involved in? Brenda?
The Crimean War?
Good. Can you name one practice she instituted?
Well, she implemented cleanliness and wanted to change the amount of dirt that was in like the units and whatnot.
Good. Why should you not wear artificial nails?
Not wear them, but they're so pretty, right?
Anyone else
Ignore
have
that.
thoughts?
You can't wear artificial nails because bacteria gets underneath them, and they're not as easy. Like the bacteria isn't easy to wash off like if you have regular length nails. So, yeah.
Good. Well, that's all the class for today.
Hey, sweet muffin top. Wake up, girl. I'm going to be your nurse today.
Hi.
Woo, girl, you stink. I'm going to give you a bath, clean you up. You will be smelling fresh.
What is that in the water?
Whoops. Dropped a nail.
You're wearing nails?
It's okay. I'll fix them later, honey.
What is in the water? Why is it brown?
Oh. You know, I just came from the patient next door, and, well, they were pretty dirty. But it's okay. I don't think that anything will happen. I mean, I'll try not to get the chunks on you.
Oh, chunks of what?
Oh, you know, just some dead tissue.
Ready? I missed you. I'm Brenda. I'm gonna give you a bath today.
Okay.
How are you feeling?
Much better than yesterday.
That's good. Probably check on that afterwards. Can I have your arm? Can you feel this for me? Tell me if it's an okay temperature.
Yep, it's good.
Okay. morning been?
It's much better, and I don't have any headache anymore, but just a little bit sometimes. at night,
Sometimes?
yeah.
I'm just gonna, I was cleaning somebody's wound. So I just gotta, cleanliness first, right?
Do you have blood on your hands?
Oh, just a little, sweetie. Don't worry. I'm a sand assassin. All right. What do you need?
My wound has been kind of hurting.
Ooh, that is terrible. Oh. Oh. Mm-hmm. Okay. I'll be right back.
I'm gonna change that dressing, clean it up a little bit. Let me know if you feel any pain, alright?
Okay.
Try to be gentle.
Ooh.
Okay, I'm not gonna bandage it up this time because I want it to see how it's gonna do without. It looks like it's gonna be fine, but if you have any discomfort or you want me to bandage it up, go ahead and call me,
All
and
right.
I'll come back and put a little bandage on it. It looks like it's doing great though.
Okay.
Okay.
Thank you.
One more. Let me just recap that. There you go.
Sure, if you want to, you can hold it. Don't look if you're afraid of needles.
Okay.
You alright?
Yep.
Good. Okay.
It hurts, but it will be fine.
Yeah, you're right. It will be fine.